In the autumn of 1918, the world experienced a fragile mix of relief and fear as people celebrated the end of a war while an invisible enemy silently spread among them. Cities overflowed with cheering crowds, parades, and relief at the armistice. Yet beneath that surface of celebration, a deadly disease moved faster than any soldier or strategy. Citizens returned home, believing that the hardest part had passed, only to face a threat that would test humanity in ways that history would rarely record. This is the story of the hidden history of the 1918 pandemic, the truths that were hidden from public view, the decisions kept secret, and the quiet tragedies that forever reshaped ordinary lives. The pandemic was not a simple, uniform event, but a complex intersection of war, political decisions, population movements, and a medical system struggling to understand the unknown. Soldiers and civilians alike moved across continents, carrying the virus with them, while factories continued production and cities attempted to maintain normal life. Hospitals, already under strain, filled beyond capacity, and entire households in small towns disappeared within days. The disease's spread was shaped not only by biology, but by social conditions, public policies, and the reluctance of authorities to acknowledge the severity of the threat. Wartime censorship greatly influenced the trajectory of the pandemic. Governments fought battles both on the front lines and in the control of information. Newspapers, under pressure to maintain morale, often omitted reports of illness among soldiers or civilians. This silence had severe consequences. Citizens, unaware of the severity, did not take necessary precautions, while countries like Spain, which reported openly, were mistakenly blamed as the source of the disease, simply because they had not hidden the facts. Misunderstanding and miscommunication amplified the pandemic's reach and its impact. The movement of troops and supplies accelerated the spread. Ships, trains, and convoys created pathways for the virus, connecting distant regions in ways that had never been seen before. Soldiers traveling from bases to battlefields and back carried the illness across oceans and continents. Ports became hotspots where one infected individual could ignite multiple outbreaks. Ironically, the very machinery of war that enabled victory also facilitated the rapid transmission of disease, creating a pandemic that was deadly on a global scale. Local decisions determined the severity of the pandemic in cities around the world. Some communities acted quickly, closing schools, theaters, and public spaces, while others delayed interventions due to economic concerns or fear of public panic. A parade postponed in one city might save thousands of lives, while allowing a similar event elsewhere could prove disastrous. The outcomes of such seemingly small choices became starkly clear as hospitals struggled under waves of patients or managed to maintain some control through timely action. In the United States, two cities became examples of how leadership shaped survival. One city imposed restrictions and saw relatively low death rates, while another allowed large public gatherings and suffered catastrophic losses. Decisions were not solely medical, but deeply political. Leaders concerned with appearance and reputation often made choices that prioritized public perception over public health, demonstrating the high cost of valuing pride over prudence. The consequences were immediate, tragic, and unforgettable. Medical science in 1918 was ill-equipped to respond. Doctors understood bacteria and could treat secondary infections, but viruses were largely a mystery. Hospitals ran out of supplies, medical students were overwhelmed, and nurses, many young women, worked tirelessly without proper protection. These caregivers became the frontline defense, relying on makeshift masks, determination, and courage to care for the sick. Their efforts saved lives and created a human legacy of dedication and resilience, though most of their names were never recorded in official histories. The disease itself was unpredictable and violent. Unlike typical illnesses that target the very young or elderly, the 1918 virus often struck people in the prime of life, aged 20 to 40, leaving entire communities grieving and destabilized. Symptoms could escalate from mild to fatal within hours, with lungs filling with fluid and skin turning blue. Many deaths were caused by secondary bacterial infections, making the illness a merciless test of both physical endurance and medical capacity. Rural and remote communities endured the pandemic in silence, often invisible to official statistics. Islands, valleys, and indigenous settlements experienced sudden waves of illness, leaving few survivors. These populations had limited access to medical care and were frequently subject to historical neglect. The loss of elders, healers, and cultural knowledge reshaped communities and left lasting voids, affecting the continuity of traditions and oral histories for generations. Economic and social disparities determined survival as much as the disease itself. Crowded living conditions, poor sanitation, and long working hours made certain populations more vulnerable. Racialized and marginalized communities suffered disproportionately, often with less access to medical care or resources. Hospitals prioritized certain populations over others, and survival was intertwined with social position, geography, and occupation. The pandemic exposed deep inequalities, revealing vulnerabilities that were often invisible before the crisis. The pandemic had far-reaching economic consequences. Businesses closed, agricultural production faltered, and supply chains were disrupted. Families faced food shortages and financial instability, while markets struggled to recover in the years that followed. Beyond physical health, the disease disrupted livelihoods and created a need for social and economic reconstruction, demonstrating that pandemics affect societies far beyond the immediate threat of illness. Political structures were tested by public outrage and crisis management. Governments already strained by war faced criticism over inadequate responses. Quarantines, travel bans, and public health measures led to tension between safety and personal freedom. In some regions, strict enforcement caused resentment, while other areas saw resistance or non-compliance. The pandemic altered public trust, illustrating the lasting impact of leadership decisions on societal cohesion. Misinformation and rumor spread alongside the virus. Even without modern technology, false stories about cures, conspiracies, and supposed origins circulated widely. Fear and grief created fertile ground for scapegoating, sometimes resulting in violence against marginalized communities wrongly blamed for the illness. The social effects of rumor compounded the pandemic, leaving psychological scars alongside physical devastation. The arts reflected the pandemic's profound impact. Literature, music, and visual arts captured grief, isolation, and the fragility of life. Creative expressions from letters, diaries, and personal accounts conveyed emotions that statistics could not, preserving a human perspective on loss and survival. These cultural responses remain valuable historical records, offering insight into the lived experience of a world under siege. Public health infrastructure evolved in response to the pandemic. Laboratories, surveillance systems, and organized responses gained recognition as essential tools for controlling disease. Investment in health institutions increased, establishing foundations for future preparedness. These developments were a legacy of tragedy, demonstrating that crisis can spur advancements that protect future generations. The pandemic left invisible psychological scars. Children who lost parents, families bereft of breadwinners, and communities missing elders experienced enduring trauma. Social bonds that normally provided support were fractured, leaving lasting effects that statistics cannot measure. Generational memory, shaped by grief and absence, became part of the hidden history of 1918.